I like gardening, camping, most of all, I like fishing. I like spend time with my son. I was a workaholic. When I was told that I have stage 4 cancer, I was numb. I didn't know what to say. I didn't know what to do. My thing is, when you have breast cancer, you're gonna die. And that's how I felt. And I wasn't ready to die. I woke up in the morning, my hair was all over my bed. Second chemo, I was very sick. I cannot do it by myself. And I don't want to leave. I want to die. I just want to die in my room. I don't have nobody, just no friends, no nothing.
As a navigator, our responsibility is to be client-centered. I made an appointment to see Edna, and then when I came to her home, then the mood changed, because I knew at that time when I was led straight into her bedroom, I thought that it was kind of odd that I was in your bedroom rather than the living room.
Mrs. Lesage walked in and came into my bedroom, and I said, I don't want to see you. And she kept praying in front of me. I don't care about your God. I don't want to. God was not my favorite person at the time.
And I'm thinking, how could I help her in a way where she can begin to help herself? Because I knew from the get-go that she was a very strong woman and that she was holding it together. And yet in another phase is that she was falling apart.
Which I want to throw her out of my room. And I just want to stay in my bedroom and just go slowly, just die slowly.
I wanted her to begin to dig deep to get the strength that she already had, and that I was going to just walk alongside her.
I needed someone, I needed help, because I fell down quite a few times.
I knew that she didn't have anyone there, and her significant other was overseas.
When I was operated, my mom passed away right on the same time. Jackie was there substituting for my mom, my sister, my whole family in Samoa. I don't have any here. Then she was there every day taking me to my appointments, to doctor's appointment, take me walk.
We developed a relationship that was basically based on trust.
From 0 up, I came to trust her.
Jihi is a mother of 3, originally from Korea. The shock of discovering she had breast cancer was devastating. The inability of her and her husband to speak English only compounded the challenges.
When I went for my doctor's appointment, I had to pull my son from school to interpret for me. I discovered through him that I had cancer.
The Franciscan Cancer Navigators serve high-risk women in our community who may lack access to breast cancer screening and care. Our Navigator program is a collaboration with the Korean Women's Association and Samoan National Nurses Association. The Navigators partner with individuals in meeting a multitude of practical needs, from finding a doctor and scheduling a mammogram, to assisting with transportation, accompanying them on appointments, and helping them locate needed resources for the journey.
Navigators are unique because, one, they can speak the language, they can relate to the individual that is from their specific culture. They're able to reach out and they know some of the cultural barriers that the individual may face.
Thankfully, Jihi was introduced to her navigator, Esther. Esther was not only a great encouragement for Jihi, but she helped her communicate with the medical staff, facilitate transportation needs, complete paperwork, secure financial assistance, and aid her husband in taking care of the kids when Jihi was sick.
It was a really hard time when I found out I had cancer. There was no one I could share my feelings with. But I met Esther, and I was comfortable to share with her.
Jackie was there As an island person, we have a lot of same thing to talk about, what we eat. And she brings papaya, she brings a coconut.
There is that need just for the sole purpose of being a Pacific Islander. It's a sisterhood and connection that we have. And the other piece is just to be able to advocate, because we're quiet people that want to please other people, and especially our physicians, because they're known as the authority. And the doctors know best, when in fact I may be feeling something, like a client said, I feel something, but I don't know how to share that with a doctor.
Whenever I was in trouble or needed help, there was Esther to lend a hand. I can't even think about what it would have been like without my navigator, Esther.
There are some people that don't take advantage of the services that are out there. They're out there, but they choose not to face their illness.
It's someone, women especially, you always a hush-hush thing.
And that's part of the Pacific Islander culture, is to be able to sweep it under the rug, and because it's out of sight or out of mind, then it doesn't exist.
I think to me, women should be strong and come out, just talk about it. I'm lucky and I've been blessed from God that I have Jackie.
Edna and Sheehy have successfully completed their cancer journey and emerged with a new appreciation for life, family, and the work of the Cancer Navigators.
I dearly want to tell other Korean women about the Navigators. The Navigators can help you. You do not need to be alone.
My purpose now is to talk to women and try to educate them about breast cancer. You know, you go there and you come out of it and even stronger. And don't let anybody tell you otherwise.